I say I'm a doctor when I go see other doctors as a patient? Why do I feel the need to do that? It's not because I'm arrogant. I mean, you may say I'm arrogant because I'm a doctor. There's some truth to that. I think I know stuff. It's not because I want special treatment, though. That is correct. I want them to treat me especially well. The main reason I do it is because as a doctor, when I see another doctor, I know it's important to know who that person is. And when I tell them I'm a doctor, I'm a hospitalist, internal medicine trained, then they know who I am a little bit more and can talk to me appropriately. Let me explain what I mean. So we all make assumptions, generalizations, all these things, and people say it's bad. But if you think about it, we really need to. So if you come into my office as a patient, I look at you. Who are you? Gender, demographics as an ethnicity, social analysis, all those things we say that, society says you should ignore. In medicine, we're taught to think about those things because there are some diseases that are predisposed for this or that, right? Second thing, I presume you speak English. Maybe all you know how to say is hello, my name is. But you say it well. And you tricked me, right? And you actually don't speak English. And I speak to you the whole time and you don't understand English, right? I mean, that sounds far-fetched. But sort of gotta know whether you speak English. Because if so, I can speak to you in English. If not, I should probably get a translator. I should understand how well you understand English. Just because you speak it, say you just are an immigrant, came here just a year ago. You may speak English, but not understand very well. I should probably talk slower, not use big words, not speak in long sentences, right? All these things I have to accommodate and adjust. And when I go in and say, hey, I just drop it somewhere that, I only work in a hospital, but, I think it's time to get some, primary care in. So I've come to find you. I see you're a great internist. You train at this place. I'm a hospitalist. I don't understand all the guidelines, all this preventive care stuff. So I'm here to ask for your help, right? Or I say, when I saw the other doctor, the sports medicine doctor on 5 foot, my leg, I was talking to my PCP, we're both internists. We don't know much about, bones and muscles and stuff. So we thought we'd ask an expert and we came to you. Thanks. And then when she responds, she talks to me differently after she realizes I'm a doctor. To patients, you may not explain things as, this is where your tendons insert, your tendons join together to tib, fib, blah, 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 right? But to me, she can, because we all went through medical school, we all went through residency, we know basic anatomy. Even though I don't know it that well, I know somewhat, right? It's important to know what base level of knowledge somebody has, so you could speak to them appropriately, so they can understand you. It's also important to know where they're coming from, right? If you're coming from a position that, hey, I have pain, I want pain to go away, versus you're coming from a position, okay, so I'm an athlete, I have some pain, I think I could work through it, but can you tell me if there's something wrong or I need a change, or just keep on doing what I'm doing? Because I'm perfectly fine, I don't want any pain medications, I'm just gonna go on with life. Those are very different approaches that you would take. And I realized, I don't know if it's a long time ago, but doctors speak to people differently depending on who they are, differently depending on who they presume they are. So firstly, we treat athletes differently than patients because most of my patients aren't athletes. They're not very highly motivated, driven. You could expect them to do a certain amount, but not a lot. Or maybe for some people, we don't expect anything, right? But, if you tell somebody, okay, yeah, so, you really need to lose some weight, you pack some on during Christmas season, so why don't you go ahead and start exercising every day this week for an hour a day? Yeah, Doc, are you joking? I walk in a supermarket every week, and that's basically the extent of my exercise. I mean, I don't exercise that much. This sports medicine doctor, I told her I'm pretty sedentary. She didn't expect much of me. And maybe that's why she said, when I asked her, should I change my gait? She said, nah, it's pretty difficult. She didn't think I had it in me. And that's fair. You look at me, I don't exercise. I tell you already I don't exercise. I don't look like somebody who exercises. Yeah, does he have the self-will motivation to change his gait? To relearn how to walk? Probably not. So why bother spending your time? Let's talk about other stuff he could do. Right? I mean, a lot of it has to do with your perception of where they are, who they are. How much can you ask of them? And I think that's why it's so important to say, hey, this is what I want. And basically, by saying I'm a doctor, I'm somewhat saying, hey, this is what I want. Because I'm a doctor. I want to know. I don't want you to just say stuff that's generally true, but may not be true in my specific case, right? I mean, like the doctor, like there's all these signs posted there saying that, oh, viral infections like the flu, antibiotics don't help, blah, blah, blah. It's like the cold. It's like, well, sure. I mean, upper respiratory infections are often viral, but they're not 100% viral. Same with coughs and things like that, right? There are some bacteria that cause things like that and other diseases as well that potentially could give medications for. I don't want these banalities said to me, and I think when they know I'm a doctor, they're not going to say it because we all know these things and we all know they're generally true, but not necessarily true in this specific person's case. And we want to know, is your goal to get better? Is your goal to feel better? Is your goal long-term benefit, short-term benefit, because you can't bother thinking till 10 years down the road? All those things are unspoken. Sometimes you communicate it by your body language, the way you're dressed, right? That's why the executive in his 50s comes striding in the door. He's treated differently because you presume he's motivated, driven, wants to get better, willing to sacrifice short-term pain for long-term gain. And then this person's sloppily dressed, hair unkempt, blah, 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 right? You presume the opposite. And you're not 100% right. And you could be wrong. But as a patient, I understand people have these thoughts. I understand there's these generalizations. And I want to do my part to just speak it out. Doc, I know I haven't been so great with my exercise, but I'm willing to try hard because I really feel like it's time to get a hold of life and to work on it. I'm willing to put the effort in. Can you tell me what I need to do? That's it, right? That changes their thinking. They thought you just wanted some pain meds. They're about to give it to you. But you're now actually going to tell them what they can do to improve their life. I think in a general scope of things, context, right? That's important.